Our mission is to help you learn the English language. We have created easy-to-follow, free educational materials for those seeking knowledge of English.
Dr. Ruth's office, may I help you?
Yes, I'd like to make an appointment to see the doctor. My name is Randy Horn.
Let's see, Mr. Horn, the doctor's schedule is full today. Would tomorrow be all right?
Yeah, I guess I can survive until tomorrow.
Would you prefer to come in the morning or the afternoon?
In the morning, if possible.
The doctor has an opening at 10:30 tomorrow. I'll put you down for then.
That would be fine.
Okay, Mr. Horn, see you tomorrow at 10:30.
Can you tell me where it hurts?
I am so glad they called you. It feels like something is really wrong with my stomach.
Does it hurt when I push here?
It's mostly on my right side. Right here.
Have you been feeling this way for a while?
I started feeling kind of sick last night after dinner, but this morning the pain got really bad.
Have you eaten anything unusual lately?
No, not that I remember.
We are going to take you to an emergency room right now.
I will feel better when I know what the problem is. Thank you for the drugs.
Hi. I was wondering if you have my test results in.
I didn't see anything out of the ordinary, but I want you to log onto our website for a printout of all of the details.
So, basically, I am okay?
If there were any major problems, I would always notify you by phone to come in.
What will I learn when I see the results on the website?
A description of each test is given on the site.
What will the numbers tell me?
The website will give you a normal range and then tell you what your results are.
Are all of my test results on that site?
Your entire test history is on the site. You can compare your results from other years.
You're looking rather pale. Why?
I couldn't sleep well recently.
You'd get plenty of sleep for you work so hard.
I always drink too much wine in the evening.
You shan't drink more wine in the evening.
Yes, you are right.
And you'd take some exercise every day.
Many thanks for your advice.
Well, good morning, Tom. I haven't seen you for a long time.
I'd been feeling pretty well until just a few days ago.
What seems to be the trouble now?
I feel run down, tired. I've been having headaches almost every day. And I'm not getting as much sleep as usually do.
Have you been eating properly? Eating the right kind of food is important for your health, you know.
Well, I haven't been eating well, I guess. I usually only have enough time to grab a sandwich and a cup of coffee for lunch.
And what about dinner?
Sometimes I'm too tired to eat anything at all.
That's not good. You don't have a well-balanced diet. Have you been taking vitamin pills?
I don't like to take any medicine at all without talking it over with a doctor first. What's wrong with you? You look pale?
I'm not sure. I feel hot and cold.
When did the trouble start?
I was sick most of the night.
It sounds like you're coming down with the flu. Let me take your temperature.
Have I got high fever?
Yes. 38.7. Do you have a headache, chest ache, or throat pain?
Yes, I have.
Now, let me have a look at you. I'd like to listen to your chest. Breathe then, deep breath, that's it. Cough, now again. I want to examine your throat too. Open wide, say A.
Ah.
Yes, it does look a bit sore. Let's take your extra weight of your chest and give you a few tests.
All right, thanks.
The test showed nothing wrong. A slight by infection.
What shall I do today?
I'm giving you some antibiotic and aspirin. Taking aspirin when you've got a fever and take one antibiotic until 4 hours and go home, lie in bed for 2 days. Take some water, then you feel better. Good morning. What can I do for you?
Good morning. I have a bad cough, and I want to see an internist.
Do you have a registration card?
No, I don't. I'm a tourist.
Then you need to register as a new patient. Can I have a look at your ID card? I need your name, age, occupation, address, and contacting number.
Here you are.
Thanks. Which kind of medicine do you prefer? Western medicine or traditional Chinese medicine?
I'd like to try traditional Chinese medicine. I heard it really works quite well if you know what you're doing.
All right, yes, he does. The registration fee is 7 yuan, please. Here you are. How is Danny?
Better now. We are just back from the hospital. We were lucky to meet a well-known doctor.
What did the doctor say?
He said that he had a really bad cold.
Shall we go back home now?
The dispensary closed. Here is the given prescription.
I bought some advanced medicine. Is there anything you need?
Probably not. Some medicine we need is ethical drug which you can't buy without a prescription.
Now what?
I'll go back home with Danny. You go to the pharmacy again.
Okay, this is the 3rd time.
What? How come? The 3rd time?
You don't have to know. Bye for now.
Be careful.
How have you been doing lately?
Actually, I haven't been sleeping well. I am kind of out of it.
Is there some reason why you can't get enough sleep?
I go to bed, but I just can't get comfortable enough to stay asleep.
When do you turn in for the night?
I usually try to go to bed around 11.
Do you have a lot on your mind when you try to go to sleep?
My mother is ill with cancer, and I think about her a lot.
Do you ever meditate or read before bedtime?
I usually watch a lot of television before I go to bed. Maybe I should try something else to help me quiet down.
Hey, Gary, great to see you again. Please have a seat. So tell me, what seems to be the problem?
Thanks, Doc. I've got a really bad toothache. I can't eat anything, and look, my face is all swollen. I think it might be my wisdom tooth.
Well, let's have a look. Open wide. This doesn't look good. Well, it looks like you have a cavity and your crown is loose. We'll need to put in a filling before it gets any worse, and the crown probably needs to be refitted. I'm going to order some X-rays.
Is it gonna hurt?
No, not at all. Just lay back and relax.
Okay, spit.
Subscribe to our YouTube channel to become a part of our growing YouTube community and to learn English effectively.